Hi there, today I'm going to talk about the NATA's position on fluid replacement in athletes. The purpose of the NATA's position on fluid replacement in athletes is to provide useful tools to help athletes establish a protocol for fluid replacement, to inform individuals about the risk of dehydration, how it affects one's ability to perform, and to establish a set of guidelines to encourage athletes to rehydrate effectively. Dehydration occurs when an athlete's sweat loss is greater than their liquid consumption. Our body's ability to maintain healthy function diminishes when dehydration of 1 to 2% occurs, of our body weight occurs. The risk of contracting heat-related illnesses begins when losses of only 3% occurs. This rate of dehydration can occur within only an hour of exercise. The symptoms and signs of dehydration initially present themselves as thirst, flushed skin, general discomfort, exhaustion, and cramps. These symptoms further intensify when dehydration is prolonged. These symptoms include dizziness, chills, vomiting, headaches, nausea, and negative performance ability. One's ability to recognize the symptoms early on may help reduce the intensity and onset of these heat-related illnesses. The NATA's recommendation for fluid replacement begins with making sure that to set a plan of action of incorporating rehydration into athletic participation, making sure to acknowledge factors such as what your environment's like, the length and intensity of athletic events, and the individual athlete's acclimatization to the area that you're exercising in. The next recommendation is that a method of rehydration be executed that flows along with each individual sport. If more frequent water breaks are available, then consumption of less water more often is prompted. This is available in sports such as basketball and sports that have more frequent breaks. If longer breaks less often are available, then consumption of more liquid less often is suggested, and that generally occurs in sports such as football or soccer or running events where water is available less often. Beverages should be easily accessible and monitored by coaches and athletic training staff. It is important that athletes arrive well hydrated to practices and games. The NATA recommends that pre-exercise fluid consumption consists of 500 to 600 milliliters every 2 to 3 hours, and during exercise it'd be 200 to 300 milliliters every 10 to 20 minutes. It is suggested that post-exercise rehydration occur within 2 hours of completion of your exercise event, and that this liquid consumption include carbs and electrolytes to help replenish the body's stores. Remember that these recommendations are only for general population, and they do not include each athlete's individual needs, and should be modified if necessary for athletes, for example, that sweat excessively and require more fluid replacement to replace that loss. Coaches and athletic trainers should monitor athletes and need to be aware of signs and symptoms of dehydration and monitor their level of hydration during exercise. These individuals need to recognize the importance of their job and the role they play in reducing dehydration. If exercise exceeds 4 hours, an addition of sodium chloride in beverages should be included. This will help reduce the risk of things such as cramps. When I worked as an athletic training student in Texas, we achieved this recommendation by providing Gatorade and water during outside sporting events. The NATA also suggests that athletes who are acclimatizing to an area their hydration needs will increase until this process is complete. Also, for sports that require a weight class, they should require pre-weigh and hydration tests to eliminate unhealthy weight loss and to ensure that athletes aren't dehydrated before participation. Young athletes who exercise at high intensity levels and possibly also in extreme heat may or may not be educated on the risks and the necessity of rehydration. So it is important to educate and strictly monitor these athletes about the necessity of fluid replacement. Also, another recommendation is that athletes are usually more inclined to drink more fluids if the temperature of their fluids is cool and the flavor is to their liking. This is especially true in warm temperature events and for young athletes. Also, fluid replacement is typically high during meals, so it is important that fluids be easily accessible and present during these times. So, in review, athletes and all involved in exercise need to be educated on the importance of fluid replacement and the signs and symptoms of dehydration. When possible, minimize exercise in intense heat. Athletes need to arrive hydrated, and they need to continue this state throughout exercise and post-exercise to rebuild those stores in your body. If fluid replacement protocol is acknowledged and implemented by all involved, risk of dehydration will be reduced. Thanks for listening.